People with BPD have difficulty regulating their emotions, difficulty regulating their behavior, regulating their thoughts, and this leads to a lot of chaos in their life.
My experience of BPD was primarily around my anger and my inability to tolerate intense emotions, and turning to self-harm and idealizing suicide as ways to try and cope with my suffering. The diagnosis is recent, but the difficulty isn't. I used to self-harm when I was in adolescence. I had a very difficult childhood. I was bullied really, really badly in school, and I was really angry, and I was also extremely out of touch with my emotions. I didn't even realize that I was experiencing anger until I started working with a psychologist. There are a lot of old ideas hanging around from older days in psychiatry about what borderline personality is and what it means to have that kind of diagnosis. Borderline personality disorder isn't looked on as a legitimate illness. It's looked on as having a bad personality, a bad character.
We also have some lingering stigma associated with the disorder, so not all health professionals are aware of the new evidence and are aware that actually people with BPD can be treated effectively with the right treatment.
We know that after 1 year of treatment, we know that the rate of self-harm, the rate of attendance at hospital emergency departments drops a lot.
Dialectical behavior therapy was really integral for me. It helped me to lay a foundation of distress tolerance skills so that I could start to be aware of thinking of my thoughts as just thoughts.
Now that we know that treatment can be helpful, there's a lot of people interested in receiving treatment. The problem is we've got a shortage of treatment programs, and we have a shortage of clinicians who are trained in how to deliver effective treatment. It usually takes about a year to complete a standard program, and so that's costly. And what we're interested in examining is whether or not people could benefit just as well from a shorter length of treatment. And we have some reason to believe that they can. We've made tremendous strides over the past 20 years. We've come from a place where people believed that this was a disorder that was not treatable. We're now at a place where people can feel positive that that treatment can be helpful, that they don't have to suffer forever, and that they can really have a life where they feel more satisfied.
Another myth about BPD is that people do not get better. Well, we know that that's not true. In fact, even without treatment, people with BPD, many, do improve over time.
Receiving a diagnosis of borderline personality disorder does not have to be a life sentence, and it doesn't have to be a disorder that stays with people forever.
And I don't see any reason why anybody who has BPD, no matter how much they struggle and how much they suffer, can't eventually get through the worst of it. Even if it happens so slowly that they're not realizing that change is happening, it does happen, it will happen. You just have to want it badly enough.